great to be back in Iowa, and it's gotten cold since I was here last. So now it feels like Iowa and getting close to caucus time. I'm very proud of the fact that we have 50 county elected officials supporting me here in Iowa. I think it's a continuation of evidence of the strength, evidence of the strength that we have here in this state. I do want to say just a quick word about health care, because I watched this sparring that's been going on between Senator Obama and Senator Clinton. I don't want to get involved in that. I just want to, there are very substantive policy differences between us on this issue. I just want to make sure caucus goers are aware of that. I was the first candidate to come out with a universal health care plan in February. I'm proud of that. I've led on this issue. I think there are differences between us. Senator Obama's plan is not universal. It does not require that everyone be covered, and as many as 15 million Americans would be without coverage, and I've seen an estimate that up to 90,000 Iowans would be left without coverage. So there's a fundamental difference between us on the policy. Senator Clinton's plan, which came out in September, is very similar to mine. It came out in February. But I have not seen any specifics about how her mandate would work or how she would enforce her mandate. I've laid out exactly how my mandate would work, and we have a way to make sure that that's enforceable. So,
how would yours work, and how does it make health care affordable for people who are required to get it?
how does my plan make it affordable?
How does the mandate work, and how do you make it so people
Can
who are
afford it.
required to get it can afford it?
Sure, of course. Well, the fundamental structure of the plan provides subsidies, and the subsidies go up to about $100,000 of income. So for lower income families, they'll be basically 100% subsidized, and the subsidy decreases as they go up toward $100,000 of income. So that's how they afford it. And the way we bring people into the system is anytime they have contact with the healthcare system or the government, they get enrolled, basically. You know, if they go to the hospital, the emergency room, or they sign up their child for school, whatever.
Why don't you want to get involved in sparring?
Well, I think we need to be focused on what we want to do I want to do as president. I think it's completely legitimate and fair for caucus goers to know where our policy differences are. And to the extent those differences continue to exist, I'll continue to make them clear. But I want to be focused on exactly.
Some suggestions.
Can I finish? I'm sorry. I want to make certain that people know that I have a very strong, positive agenda and have from the beginning about what I want to do as president.
Sir,
Yes,
do
sir.
you agree with Senator Clinton that Senator Obama is not going to fight on universal health care?
What I believe is his plan is different than mine. And my plan is universal. And I think that's a threshold requirement for health care reform in this country. And that's why I came out with my proposal and have the mandate that requires everyone to be covered. So he came out with a different plan. He did come out with his plan, I think a few months after I did, and it's my understanding is it's not universal.
Does it make him a less worthy Democrat?
Oh, I'm not interested in that kind of language. I want people to know that there are real differences between us on this issue and what those substantive differences are. Those are the choices voters have.
Have you seen the racist flyer that is in support of you? It's been going around?
I have not, but I heard about it and I completely reject and denounce it.
There are those who suggest that both of the leading candidates can be hurt by this back and forth. They point to history and Howard Dean and Dick Gephardt shooting each other in the last cycle. Is there a danger that these leading candidates could ding each other up?
Oh, well, there are many dangers constantly in politics, and I can only speak for myself. It's important from my perspective that if we have policy differences, that voters know about them. But that more important for me is to ensure that caucus goers here in Iowa would know the specifics of what I want to do as President of the United States.
But does the back and forth between those two threaten to, marginalize your efforts as the attention kind of gets drawn to them?
You guys want me to be a political consultant, don't you? I'll
Spend enough time in Iowa to be one.
I know the people in Iowa. What I think is most important for me is to stay focused on what I want to do as president. And to the extent we have policy differences, I will certainly point those out, but I'm not interested in petty bickering.
Senator, I want you to be a television critic. I don't know how much you watch television, but did you see the Republican debate last night?
I did not. I didn't see any of it.
When you're part of these debates on TV, I mean, Do you just have no interest in kind of seeing what the other side's going on? or-
I was working.
You were working.
Yeah, that's why I didn't see it. I have seen I've seen a little bit of a couple of the Republican debates, but I didn't see the one last night. Yes.
Senator Obama said yesterday that Hillary Clinton, by pointing out that his plan wouldn't cover 15 million Americans, was simply making a political point. Do you agree with that?
Oh, I think there is a substantive policy difference between Senator Obama's plan and my plan. Mine is universal, requires everyone to be covered by law, which is the only way you have to have a mandate, a legal requirement to make it universal. And his plan is not. He made a different choice, and he's totally entitled to defend it. But I believe we should have truly universal coverage.
How important is the fight down the home stretch for these undecided voters? The crowds are full of them. Just here sampling everybody.
Oh, it's obvious. I mean, there's huge numbers of people in Iowa who haven't decided who they're going to caucus for yet. And I think the same thing was true in 2004, which is why you saw a lot of movement in the last few weeks. And I think what's really important is for me to make clear that I want to restore trust between the President of the United States and the American people, that have specific ideas about what we need to do to make democracy work for everybody, not just for the few, and that I can win in the general election.
Is it more important to go after those undecided?
Thank you all.
Thanks, everybody.